And we're back with our health lead today. Countries around the world are rushing to send aid as a new wave of coronavirus explodes into a crisis in India. That country has added more than 1 million new COVID cases in just 3 days, and the soaring number of hospitalizations has led to severe shortages of oxygen. Overflowing hospitals in the capital city of Delhi have resorted to tweeting out SOS messages begging for supplies of oxygen. At least 20 people in one hospital died over the weekend after an oxygen shipment was delayed. Let's get straight to CNN senior international correspondent Ivan Watson, who joins us now live. Ivan, how did this second COVID wave spiral out of control so quickly?
Complacency, Jake, is one word that some Indian public health experts have used. They say, after all, the health minister of India 6 weeks ago was claiming that the country was in the end game of the pandemic, and the prime minister was holding huge campaign rallies less than 2 weeks ago. Now you have these record-breaking numbers, and the World Health Organization's top scientist estimating that the actual number of infections is probably 20 or 30 times more than what we're seeing. So Indians are desperately trying to find treatment for their sick loved ones when oxygen is in extreme shortages for hospitals. You have these desperate scenes of people going from hospital to hospital trying to find a hospital bed for their relatives, like this man. Take a listen.
The doctors warned us that if we take my father to the hospital without oxygen support, there is no guarantee he will be okay. But we just couldn't find an ambulance. In desperation, we had to take an auto rickshaw. He was gasping for air and just removed his face mask. He was crying, saying, "Save me, please save me." But I could do nothing. I just watched him die.
And Jake, day after day, we've been seeing multiple hospitals putting out these messages on social media, begging for oxygen, saying they have scores or more than 100 patients and only hours or minutes of oxygen left for them. It really is a scary situation, Jake.
And Ivan, we know that President Biden spoke to the Prime Minister of India today about sending emergency assistance. What do we know about the aid heading to India, not just from the U.S., but from other countries as well?
Yeah, the U.S. is going to send PPE and parts to make vaccines. The Pentagon saying it's going to help with logistics and transport of these goods, respirators as well, and also aid promised from France, Ireland, the UK, even Pakistan.
All right, Ivan Watson, thank you so much. Appreciate it. Let's discuss all this with CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, 1 million cases in 3 days in India. That's an absolutely devastating milestone. How much worse could this get before it gets any better?
Well, Jake, we've had this conversation about these lagging indicators, for some time. People know that the numbers of people who are infected a few weeks behind that is when the hospitalizations will surge as bad as they are now. Some of those images will get worse because that's what we know is that the hospitals come after and then the deaths a few weeks after that. So the next 4 to 6 weeks, Jake, no matter what happens, even if the cases were starting to dramatically decrease, which they're not, but even if they were, we'd still be talking about this for the next 4 to 6 weeks of what's going to unfold in India. Also, keep in mind, Jake, we see these numbers, but positivity rate is over 20% as well. You may remember, that means they're not testing enough. So the actual numbers could be much, much higher than even what we're seeing there.
We know that the longer COVID spreads, the more possibility that the virus can mutate. Is there also a chance that new variants could develop in India, ones that our vaccines cannot protect against?
Yep, that's the concern. I mean, that is always the concern, whether it's in India or, frankly, anywhere else in the world. India, obviously, has got a lot of attention on it because there is so much spread there. But these viruses do mutate, and typically the mutations just random occurrences and often not problematic. But every now and then it'll mutate into something that could be something that makes the vaccine less effective or even develops escape immunity, meaning your existing antibodies don't protect against it anymore. So it's not clear that that's there yet. There's a couple of different mutations that they're focused on in India, including B.1.1.7, the UK variant. We know it makes it more transmissible, but immunity through vaccines is still going to be the key.
And an official confirms to CNN that the U.S. going to soon start sharing doses of the AstraZeneca vaccine with other countries. How much of an impact could this make, especially in India, but also other countries where vaccines are not as readily available as they are in the U.S.?
Well, it'll make a big difference, no doubt, Jake, but it won't be an immediate difference. Let me show you, first of all, just the disparity that we're talking about with vaccines in wealthy countries versus vaccines in even low middle income countries. I mean, Jake, that's 81% of the global vaccine doses administered have been too high in upper middle income countries. 0.3%. I mean, it's not even close. And again, we're obviously talking about a pandemic, something that affects the whole world. We're talking about a virus, a thing that can infect any human, regardless of where you live. So that's a disparity that has to be addressed for the sake of the whole world. It doesn't matter where you live. If you have that kind of disparity, we know that virus will spread, and those mutations that we talked about can become more likely. Right now, we're vaccinating about, I think, 1 person per second in wealthy countries, and there are other countries in the world that have not received a single vaccine yet. So it's a problem. But what makes a difference now? You got to stop the viral transmission. And that is the same basics that we've talked about for over a year now. The high filtration masks, the physical distancing. In Delhi, they're going to be in lockdown until May 3rd. Those things will make a more acute difference than even the vaccines.
Dr. Sanjay Gupta, thanks so much.